organization to raise awareness about the importance of digestive health and the prevention and management of gastrointestinal disorders. This year's themes, Your Digestive Health, Nourish to Flourish, emphasizes the critical role of digestive system in overall well-being and encourages individuals, healthcare professionals, and policymakers to work together in promoting healthier lifestyles, early diagnosis, and access to quality care. As we commemorate World Digestive Health Day, let us make this opportunity to learn about the digestive system, support research and innovation, and empower communities to take proactive steps towards the better gut health. To have the auspicious beginning of the occasion, we request our dignitaries to kindly come on stage for lamplighting.
नमो शार नमो शारदा नमो शारदा नमो शारदा माता नमो शारदा नमो शारदा नमो शारदा माता नमो शारदा नमो शारदा नमो शारदा माता नमो शारदा माता नमो शारदा माता हे विद्या बुद्धि प्रदायिनी हे विद्या बुद्धि प्रदायिनी मां वीणा पुस्तकदा जनी शारदा माता.
Thank you all. We welcome our dignitaries with a token of gratitude from Team ILBS. We would now like to felicitate Chief Guest Shri G. Kamla Vardhan Rao, CEO, Food Safety and Standard Authority of India, Government of India. We would now like to felicitate our Chief Guest, Nita Sharma, Director General Health Services, Government of India. We would now like to felicitate our guest of honor, Dr. Yutaro Sipoya, Team Lead for NCDs and Comorbidities at WHO India Country Office. Thank you, sir. Now we request Dr. B.B. Tiwari, Professor Clinical Research and Epidemiology, former Regional Advisor for Viral Hepatitis, HIV and STIs, WHO Southeast Asia Region Office, to kindly present the welcome address and objectives of the event.
Good morning. On behalf of the Institute of Liver and Biliary Sciences, it's my proud privilege to welcome you to this event on World Digestive Health Day. And thanks for taking time out of your schedule and be here today. Before we move on to the function proper, for the benefit of audience who are from different fields outside ILBS, also even among the participants, I would like to give a very short brief about the Institute of Liver and Biliary Sciences. Established in 2010, it is the first and only liver-focused super specialty institute in India. It is the largest liver emergency setup, more than 10,000 cases in a year, and a liver ICU attendance of more than 4,000 cases per year, which is unmatched by any other institute. Also, it is the highest volume liver transplant center in government sector in India. More than 1185 liver transplants have been performed so far. And what is important is many people who pass out from here now are performing liver transplant and doing the hepatology service at different institutes across the country. ILBS is also supporting AIMS Jodhpur and AIMS Odisha Bhubaneswar in setting up their liver transplant, and it is already started. We have advanced diagnostic and therapeutic facilities like advanced endoscopy, hepatic hemodynamic laboratory, artificial liver transplant, and it is also a deemed to be university under UGC Act, and we run courses on DM, hepatology, MCH, PhD, and number of PDCC programs. It is a WHO collaborating center for viral hepatitis or chronic liver disease, inaugurated 10 years ago, and you can see the WHO representative, Dr. Nata Manabde. This was in 2015 that we had this center, and this was the second center globally. First was in CDC Atlanta, and second was ILBS in India. We are also part of WHO Southeast Asia Cancer Grid, and we have Dr. Yutaro, who looks after cancer component in WHO India. We also have a Department of Health Research ICMR training center, and we have a number of other collaborations with institutions outside. We have more than 850 research publications. We have pioneering work on liver regeneration using growth factors, stem cell. We have operational research on cost-effective liver transplant models, basically, which will make the transplantation accessible in public sector on a larger scale, because we have a big gap in percentage of liver transplant required and being performed. It is also a training hub for Project Prakash, lead ECO project. It's a global liver training collaborations, and we have 24 postgraduate postdoctoral courses annually. In addition to the academic and hospital work, public patient services, we also have a lot of public health outreach. The number of campaigns, campaign empathy to raise awareness about hepatitis B, campaign Boom for pregnant women with hepatitis B, Project Smiles, which is an initiative which aims to make stronger India through 1 million health educated patients. We have reached to 40,000, but we are now also having a Y Smile, which is focusing on the young people. So we also have Delhi Plasma Bank initiative during COVID-19, and we are also working with the Ministry of Health, and we have supported integration of non-alcoholic fatty liver disease into NCD program. So as Pratibha has already briefed, World Digestive Health Day is held annually on 29th May to raise awareness. So the key objective of this event are to raise awareness about the importance of digestive health, promote preventive measures, healthy lifestyles, educate people on nutrition role in hepatobiliary function, and also this is a platform to have a multidisciplinary approach to this problem, which involves healthcare professionals, researchers, policymakers to exchange knowledge, best practices, and look to collaborations with FSAI and other institutions on moving ahead on digestive health. Lastly, we are also having a free liver health checkup camp today outside this auditorium, and I see many people from the adjoining areas who will come for the checkup. Thank you. Thank you very much, and welcome again.
Thank you, sir. Gut microbes play an important role in maintaining gut homeostasis. To know more about gut microbes and digestive health, we invite Dr. Shwetank Sharma, Additional Professor, Molecular and Cellular Medicine. He has worked extensively in association of gut microbiota with liver diseases and was instrumental in establishing the fecal microbiota transplantation services at ILBS.
Good morning, everybody, and best wishes for the World Digestive Health Day. I'll be briefing about some work that we have done and some background on why gut microbiota is important. This is a very hot topic, and it links us back to our traditional roots of medicine, where and common practices that we have in our families, where people, our parents, our grandparents have always been saying, eat healthy. But eat healthy does not mean only eat whatever is benefiting your body, but there are other members in our body which are not human, and they help our body to actually improve in health. And when we talk of digestive system, we not only talk of our stomach, the intestine, and whatever is excreted out there, but we have to involve the liver, because all the food that we eat is processed by the liver and then distributed to the rest of the body for the usage. So the gut microbiota actually is an equally important part of cells of the bacteria that we have in the body, including the skin, is the same number of cells that we have of the human cells. So the graph on the left here shows the number of cells that we have, and this is 10 to power 11, 10 to power 12, and all these numbers, the power numbers, you can add as many zeros after 10, and you will have a very, very huge number to actually realize the number of the bacterial cells that we have in the human body. Of course, diet is important, but then the diet that we take is not only used by the human cells, but is also processed by the bacteria in the gut. And when I say gut, I mean from the mouth till the rectum, the whole length of the gut. These processes interacts with the molecules that are produced by the human intestine, and then ultimately lead to a balanced good health. There are two types of responses that these bacteria have to diet. One is when we take high fiber or high plant protein, high plant-based diet. Here we have, of course, proteins, carbohydrates, and maybe fats from some plants. But then there are fibers or some carbohydrates which are not digestible by humans per se. This process is then carried out by the bacteria, and they help us at digesting these and providing us molecules which not only help us in having a good health, but these molecules also help us in overcoming diseases also. So, for example, the indigestible polysaccharides undergo what is fermentation. We generally correlate fermentation with having generation of alcohol, but it is not always true. Fermentation always leads to breakdown of these polysaccharides and produces some small molecules which are beneficial. These are called as short-chain fatty acids. These short-chain fatty acids are then passing through the intestine, going to the liver, and where the blood glucose is brought down, the insulin production is increased, and overall energy expenditure is also increased. But what happens when we have a poorly balanced diet? Here, generally, the protein degrading enzymes are activated, and these enzymes of the bacteria not only degrade the proteins that we are eating, but also start degrading the proteins that are produced by the human body also. And these leads to reduction in the mucus, which is the protective lining in the gut, increase in ammonia, organic acids, indole propionates, and acetaldehyde, which binds to molecules, proteins particularly, and prevents them from working. This also leads to damage of the gut, which leads to release of the pathogen-associated molecules, leading to increase in pathogenic molecules which cause cardiovascular diseases also. So in this case, ultimately the blood glucose increases, insulin levels decrease, and the metabolic endotoxemia sets in. In addition to this, our general habits of how frequently we defecate also regulates the kind of bacteria that we have in the body, and a regular cycle is to be maintained so that we maintain a healthy gut bacteria composition in the gut. The gut transit time, which is basically the amount of time that food is taken in and processed over time in different parts of the gut and then defecated at the end on the next day, is also regulated by gut bacteria. And the bacteria controls not only the gut motility, which is how the food passes through the gut, but also the fecal water content, which related with constipation, which we often say that we have to drink a lot of water to keep the system working. The microbial metabolism, again, saccharolysis is what fermentation is, and then proteolysis, where the protein breakdown occurs, which leads to difference in the bacteria. The numbers that are here are the range that have been found in healthy and disease. So let's not consider that the stool sits in the body for 134 hours, but this is just for reference. So overall, if I summarize, don't have much time. So the pathogen associated molecules are removed or reduced by the gut bacteria. The bile acids that the liver produces and are important in fatty acid metabolism, these are converted to secondary bile acids, which actually take up the fat from the intestine. The fermentation of carbohydrates leads to the short chain fatty acids and other bioactive compounds which are stimulated from the intestine. The immunomodulatory compounds are also released, which help us prevent infection in the body, because we have seen like millions and millions of bacteria. Anytime any one bacteria can cause infection. So what are the signs of a healthy gut? We have a pain-free bowel movement, high levels of energy, no gas and bloating, mental clarity is there. But when we do not have a healthy gut and there is dysbiosis, we have upset stomachs, there is gas and mucus-filled stool, nausea, and other problems because of this. So overall, this gut not only regulates the digestive system, but the pathogenic molecules that are produced affect the other parts of the body also. I will now come to how do we treat it. And the common ones are probiotics, prebiotics, and fecal microbiota transplant, which is taking out the bacteria from the feces of the healthy donor and then transplanting it to a diseased individual. With this background, of course, sleep and exercise are very important because they themselves regulate the bacterial composition. So with this background, we proposed a program to the Ministry of Ayush, and we were awarded the Center of Excellence to determine the Indian foods and Ayurvedic drugs which are healthy, which are helpful for bringing about a healthy liver. So some of the preliminary work that we have done, in animals, what we did, we took some high protein and high fiber and gave them very high fat diet, which is like 60% fat. And what we find is that with vegetarian proteins and with the egg protein, there was a difference in the kind of bacteria that we have. Of course, all these animals were healthy. We also did another experiment where we took dried carrot powder and we gave it along with the high fat diet, which means not as a medicine, but along with the high fat diet, we are giving this powder. And what we see is that the glucose tolerance, it goes down immediately. Insulin resistance also is benefited. And what we see is that in these animals, the liver enzymes, which are marker of liver damage, ALT, AST, bilirubin, they almost go to like 25% of the diseased animals. Not only that, the cholesterol, triglyceride, and LDL are also reduced with just dried carrot powder, even when it is given with high fat diet. And what we find is that you may not see much difference here, but mathematically, when we count these numbers, we find that some beneficial bacteria like Bifidobacterium lactobacillus, they are increased by just this small remedy or intervention. And when we take the liver samples, what we see is that even in presence of high fat diet, when this carrot powder is given, we have a very, very suppressed amount of steatosis. Fibrosis is also going down. In another study with the patients, we conducted a program in collaboration with National Institute of Nutrition, and where we gave millet-based diet and compared it to the standard diet for treatment of NAFLD patients. What we find is that both the diets have similar effect as far as bacterial composition is concerned. But then what we find is that with the millet diet, there was a reduction in fibrosis levels. So yes, millet diet is good as far as fibrosis is concerned, but it does not have much effect on the bacteria when compared to the standard diet. So both the diets can be given based on what the patient profile is like. But again, it is always better to have a healthy, nutritious food and then prevent the disease rather than setting in the disease. So I would end with a cliche of the advertisement line that I picked, Pet Safa Har Marz Dafa, which was a very old adage that our families have been saying all through, that if your stomach or the belly is all right, then all the diseases will be away. Thank you.
Thank you, sir, for the informative talk. Ladies and gentlemen, liver health is now synonymous with Dr. Salim, who has been proactive in guiding innovative therapies and importance of nutrition in liver and gut health. We invite sir to enlighten us on Nourish to Flourish, diet, fatty liver, and NCDs.
Thank you. First of all, on behalf of Team ILBS, it's a privilege for me to welcome the dignitaries and the awardees today. Dr. Shwetank had done a great job, although his time was limited. He is our man behind the scene. I will try and touch base of diet, fatty liver, and non-communicable disease, because we have both the food safety and security standards person and also the Director General Health Services. So greetings from ILBS. I have nothing to disclose except some of these work have been done by people better than me. I'll try and share what diet. So we always have a concept of carbs, fats, proteins, but the concept should be food and gut bacteria. So what we eat is processed by gut bacteria. This is a beautiful paper in Nature by Dr. David. Now, 3 days of diet. This is a plant-based or animal-based. So if you take 3 days of plant-based, I see the dates, the fiber content in plant-based diet increases. But if you are taking the Western egg meat diet, the fiber goes down. Logical. The fat decreases, increases. The protein, of course, vegetarians may have less protein, but animal-based, more proteins. Now, the diversity of the bacteria in a given, let's say, 100 bacteria, the differences, different types. When you take plant-based diet, it maintains. But if you take animal-based, the diversity decreases. And also from baseline, what bacteria you have, how much do they increase? So when you have the animal diet, the bacteria of a given type may increase. Now, this is very interesting and new information for many of you. So when somebody has a high fat diet, some bacteria are increased. And the reason is that these bacteria are resistant to digestion of fat by bile. So more bile is produced, more bile is. These are the 3 bacteria. Now, if these bacteria are there and resistant to bile acid, which digests, more bile acid has to be produced. And these bacteria, when they break down, or these products, when the fat is broken down by, so the original bile acid is broken down to deoxycarboxylic acid, DCA. Higher DCA in the bowel leads to liver cancer, bowel disease, and many others. And the evidence of this is that the boiled salt hydrolysis are increased. In gut, in nutshell, some bacteria are resistant. If they increase, they are harmful. And they are related to high fat. Now let's look at fructose. The season for colas and fruit drinks is there. So somebody has fructose sweetened beverage. So in a period of 2 weeks time, the serum triglyceride, you can see here, triglyceride levels have gone up from 150. Similarly, the sugar levels will go up, hepatic fat, body fat. So remember before you take a drink. So what are the good food items? I'm sure you may aware of it, but still. So this is the effect of apple. If somebody is taking apple, the apple has pectin, and the pectin makes bacteria resistant even to alcohol. How does good bacteria or resistant bacteria develop? Pectin has 53 short chain fatty acids. Because of the skin of the apple and these short chain fatty acids, the triglycerides go down, cholesterol goes down, and oxidative stress goes down. So please have apple with the skin. Walnut. Now walnut has huge amount of energy. 100 grams gives you 600 calories. But it also gives you good amount of saturated fat, which is good for us. So walnut gives you omega-3, fiber, vitamin, and all antioxidants. See, melatonin, you take a pill to sleep. Why don't you have some walnuts and you may have a good sleep? Turmeric or curcumin. It has been debated, but I just want to tell you it is the best molecule as an antioxidant, anti-inflammatory, antimicrobial, anti-tumor, and reduces liver fat. It decreases your TNF alpha, TG, enzymes, and increases HDL. Garlic, it is a very useful compound except the smell. So don't tell that you have taken garlic. Others will tell you, have you taken garlic? That's all right. This actually inhibits the fat content, and these are all provided by Dr. Sukriti to me, reduces weight and body fat mass. Dr. Shwetank emphasized on the powder of the carrot. These black carrots are available in India. They are very rich in antioxidants, beta carotene, convert vitamin A, and supports regeneration, anti-inflammatory, good digestion, good bile production. Ginger, better than your ginseng of Korea. We don't use it, but it is one of the best. In fact, today only, Sukriti has sent a paper where ginger and jamun are doing better. So ginger is a very strong antioxidant, improves insulin sensitivity, glucose metabolism, and anti-fibrotic. Chickpeas, we think it is a poor man's food, but it should be the rich man's food because it improves dyslipidemia, blocks cholesterol transport, and high plant-based proteins. Coffee, our favorite, reduces gamma GT, chronic liver disease risk, fatty liver, cirrhosis, liver cancer. And this is what Jaya, my colleague, she had prepared an Indian diet. We all were Mediterranean diet, but about a healthy Indian diet. Mustard oil, poor man's mustard oil is good. Milk, buttermilk, moong, wheat. I would change it now from wheat to maybe uh, other millets, pulses, and fruits with low sugar. It all depends on what you eat. Probably 60% of the food should be uncooked. The request to Rasa, encourage natural and organic food to Indians. Display of nutrients on all food items should be in bold and big letters. I'm sure you are aware of it. We are not telling people how much sugar. Just to give you, if you have taken 5 oranges in a day, your sugar quota is over. You can't have any sugar in the tea, coffee. So that is a mental setup. And of salt, which should be minimum. Cooking material is never displayed. Awareness about healthy food is actually not given. And we also have DGHS. He might take a note of this. So you become what, how much, and when you eat. I won't have time to discuss. I'll just briefly touch on now fatty liver part. So less than 5% fat is normal. If the liver has more than 10% fat, it is fatty liver. It becomes whitish. It is due to calories, type of food, and genes. This is an ultrasound which shows fat in the liver. This is the kidney, this is the spleen. Liver and spleen should have same grayscale. What does surplus fat do? It inflames the liver. So liver, all these cells are balloon. This is normal liver cell. This is a balloon cell which has fat and it is called fatty liver. Over a period of time, body's white cell WBC will kill these fat cells, causing hepatitis. The blue dots are the immune scavengers, and the ALT levels increase. This heals by fibrosis, which is from grade 1 to grade 4. Grade 4 is cirrhosis, and it may need a transplant or it may convert into liver cancer and require. Just to emphasize to Madam, that 39% of liver cancers in India are in diabetics. And the journey starts from fatty liver. The second part of this is involvement of other organs. So if there is fat in the liver, the insulin doesn't get into the liver cell. This is insulin resistance. More insulin is produced, leading to exhaustion of pancreas and diabetes develops. So fatty liver is the core to development of diabetes. In fact, diabetes is a liver disease. Once there is fat in the liver, it will be secreted into the blood as high cholesterol, high triglyceride, leading to deposition on the arteries, leading to blood pressure, heart, kidney disease, bone, cancers, stroke, and gallstones. So fatty liver, in a way, madam, is a core to all NCDs. And I think, and we believe, published that it's a top public health issue. It is just getting published in Lancet in this week or next week. So fat in the liver is bad based on a UK biobank, 327,000 people, that if somebody has fat in the liver, it leads to increase in liver enzymes. Diabetes is 4 times more. Cholesterol, lipids are high. Blood pressure, hypertension is 2.8 times more. Heart disease is more. Dementia, mental health, Alzheimer's, and of course, cancers are high. So fatty liver is bad. The request to Madam, fatty liver be considered as core to metabolic diseases and included in all health screening programs in the country. How common is fatty liver? It is 1 in 3 in India, and this will drive the next century. More than 30 crore adults are having fatty liver. And in Delhi, we did this and published last year. 1 in 2, 6% of the 6,000 screened with fibroscan had fatty liver. Importantly, 11% were lean, and this was supported by Mylan, a pharma which had given us the bus, and we had taken this around in Delhi. Now we have done about 40,000 plus people. So the question is, can you, without having a medical degree, diagnose fatty liver? So first is, as I told you, all diabetics have fatty liver. All those who are overweight or obese will have fatty liver. Those who are normal weight or lean, less than 23 BMI, but their waist is bigger, that is typical of India, visceral fat, central obesity, or they have blood pressure, or triglycerides are high, HDL is low, or HbA1c is pre-diabetic, or there is a family history. So if you have this in mind, sir, you can always say, oh, in my ministry, you have fatty liver and you need to eat this. And I have shown you what to eat. So what is the action number 1? Today, on this 29th of May, which is the day when Mount Everest was scaled first time by Hillary and Tenzing, 29th May is remembered for the victory of human beings on nature. My suggestion is the first action is change the attitude. The only single, don't say fatty liver, so what? It's a fire alarm, listen to it and try to extinguish it. The government of India listened to us in 2021 and the Honorable Minister included for the first time in the world fatty liver into the screening program of NCDs, making India number one, numero uno. Why to decrease fatty liver? Why should we be worried? This is the study from Korea. I want to emphasize 3 million Koreans 2009 to 2013 were followed. These were those who developed fatty liver during this time. Diabetes was double, heart attacks were more, stroke was more, death was more. But more importantly, those who had fatty liver, if the fatty liver regressed, death was reduced. So one single awareness, death is reduced. You don't need to have hi-fi cancer centers or so. You need them, but the money can be spent more on prevention. So my last slide and message is task for health and food services in the country. To win over diabetes, NCD, cancers, we need your goodwill to provide good health for Indians and to learn about healthy food and to disseminate this knowledge about healthy food and prevent and treat fatty liver. With this, a healthy diet, a healthy gut, a healthy liver, and a healthy India. Thank you so much.
Thank you, sir. We also welcome the initiative by Government of India for a mandatory sugar board in school and educational institutions so that they know the content of the products that they are consuming. Our guest of honor today is Dr. Sunita Sharma, Director General Health Services, Government of India. Dr. Sharma has previously served as additional DGHS under the teaching subcadre of CHS, and she's a graduate and postgraduate from KGMC Lucknow, joined the Department of Pathology at LHMC New Delhi, and served as Director Professor. With more than 200 publications, Dr. Sharma has published book on concise hematology for the undergraduates, and she has been awarded with the Eminent Medical and Health Education Teacher Award by DME. Key areas of interest are anemia and coagulation, and definitely anemia is associated with the nutrition. So we request ma'am to kindly address the gathering on liver health, the foundation of digestive wellness, current challenges and future directions.
Good morning, everyone. The dignitaries on the dais, Shri G.K. Rao, CEO, Food Safety and Standards Authority of India, and Dr. Gitaro Setua, WHO representatives, and Dr. Sareen, Director and Chancellor ILBS, Dr. Dogra, Vice Chancellor ILBS, and Dr. Diwali, Professor ILBS. It's my privilege to address this August gathering today on the World Digestive Health Day. And as sir has already pointed out, the liver disease burden is increasing in India. And apart from the infections, that is viral hepatitis, there are the non-alcoholic liver disease, fatty liver disease is now emerging as one of the disease which is affecting, as we know, is 3 to 4 out of 3 to 4, 1% is affected. And it's all because of our dietary habits and lifestyle. We have seen in our homes also, the children, they are sitting with the bottle of Coke and a packet of chips and watching, just sitting there. So actually we have to take initiatives from within us and from our home only. And regarding the recognition of this non-alcoholic fatty liver disease, the government has taken initiative and it is included in the program of the non-communicable disease, and the guidelines, as sir has shown, they are released in 2024. because of this, we have seen the mobile services also it can reach to the peripheral areas also to screen the population for this early changes in the liver, which if they are taken care of, it can be reverted. And there is integration of Ayush also now in medicine, and like told that the as our honorable Prime Minister has said regarding the obesity, and he actually praised the CBSE for the sugar boards in these schools, so the children from the beginning can learn what is good to eat. And it's not only the healthcare who are responsible for this. It's the joint effort of all the stakeholders, even the community people. They should actually, together we can fight this liver disease, because if the liver is healthy, the gut is healthy, we are healthy. So the slogan "Nourish to Flourish" is very apt. If we have good, healthy habits, naturally we will flourish. So we have to change the attitude. And one thing, sir, I can say is that walk the talk. Even I've seen in my ministry also, the box contains one sandwich, one kachori, one samosa, one drink, and chips packet and roasted dry fruits. So we have to change within ourselves. So I try to change it, that we should always take healthy diet and healthy food so we can flourish. So together we can flourish and fight this disease. Thank you.
Thank you, ma'am, for the enlightening words. Our guest of honor today, Dr. Yutaro Setoya, is a team lead for NCDs and comorbidities at WHO India Country Office. Specializing in public health, he has over 20 years of experience in health research and health system development, especially in the community health and global mental health. May we request sir to kindly address the gathering today on global perspectives on digestive health challenges and WHO's collaborative efforts.
Sri Kamala Rao, CEO of SSAI, Dr. Sunita Sharma, DHS, Dr. Sarin, Director and Chancellor ILBS, Vice Chancellor Dr. Daga, Professor Ribari, and distinguished guests, ladies and gentlemen. Good morning. First of all, I would like to thank ILBS for organizing this important event and inviting WHO. And I would like to make a remark on behalf of our WHO representative, Dr. Roderick Offrin, who unfortunately couldn't make it today. As we mark World Digestive Health Day, we face a sobering reality. The digestive disease collaboratively affect nearly 4 billion people globally, ranking among the world's most prevalent health challenges. From malnutrition to cancer, the burden of digestive health is both vast and complex. It knows no borders, but the impact varies. While high-income countries struggle with conditions like inflammatory bowel disease and colorectal cancer, the low and middle-income countries bear the burden of infectious gastroenteritis, streptococcus, and hepatitis, many of them preventable. Aging population and changing dietary habits have further intensified digestive health issues worldwide, and India is not an exception. My family was also affected by digestive health. It was back in year 2000 when COVID-19 was still there. My mother was diagnosed with pancreatic cancer. She was 71 at that moment. But unfortunately, we found out that it was already stage 4. So I wish we could have make an early diagnosis. But at least in Japan, she was able to receive a good palliative care, which is part of spectrum of care we provide. It was difficult for me because at that time I was not in India. I came to India only 2 years ago. And at that time I was in a small island called Tonga. It's a small Pacific island in the Pacific Ocean. And I was managing the COVID-19 because it was year 2000. So it took me 6 months to go back to Japan because somebody from WHO needs to come to Tonga to take cover of me to provide support to the Tongan government to tackle the COVID-19 issue. And then after 9 months, I was able to go back to Japan and meet my mother, who was very frail, but still, because of palliative care system, she was able to stay at my house. And I spent about 1 month of good quality time with her to spend some best moments with her before I go back to Tonga again. So I wish there was a good, better system in early diagnosis, better treatment to fight cancers, digestive health issues, including various cancers. And WHO's approach for this, for digestive health, is we don't have separate digestive health department as such, but it's rooted in a global action plan for the prevention and control of NCDs. It has 4 pillars, and these are all applicable for digestive health as well. First is advocacy, partnerships, and leadership. So I'd like to thank RLBS again for organizing this awareness-raising event and also bringing leadership and partnership together. Second is health promotion and risk reduction, focusing on reducing modifier risk factors such as tobacco use, unhealthy diet, which we learned a lot from Dr. Sarin and Dr. Rivari today. Also, physical inactivity and harmful use of alcohol. And also, it's important to address the 9 social determinants of health through health promoting environments. The third pillar is system strengthening for early detection and management, enhancing health system to ensure early detection, effective management, and treatment, including palliative care of NCDs and their risk factors, with an emphasis on people-centered primary health care and universal health coverage. WHO would like to commend the Ministry of Health and Family Welfare for their effort to strengthen the primary health care through the Ayushman Arogyam Mandis and also through the NPNCD program. And the fourth is surveillance, monitoring, and evaluation in research. And as I see this morning, there's a lot of research happening in India, many of them from RBS. Our partnership, WHO's partnership with India as a model of collaboration. We work to support Ministry of Health and Family Welfare in progressing the NCD agenda with support from various partners, including a number of WHO collaborating centers, including the RBS. RBS has been a WHO collaborating center for viral hepatitis and liver disease since 2015. And over the past decades, our work with RBS has led to a number of technical guidelines, professional trainings, and groundbreaking researches and policy support, not only in India, but across the region and globally. RBS's role in WHO's cancer group has strengthened cancer surveillance, vital for tackling liver cancer and other cancers, a measure of chronic liver disease. WHO remains committed to supporting India's journey toward that digestive health for all. And this year's theme, your digestive health, nourish to flourish, is a timely reminder that what we eat, and how we care for our bodies directly impacts our health and quality of life. In India, our dietary habits and lifestyle choices are rapidly changing. We have heard today about increase in obesity and fatty liver disease in India. It is important than ever to raise awareness about the prevention detection of digestive disorders, and many of these conditions are treated through simple steps. Eating a diet rich in fruits, vegetables, and fiber, staying hydrated, engaging in regular physical activity, and seeking timely medical advice when symptoms arise. We have been working closely with Government of India and especially with FSSAI on food policies and innovation and regulation, to make healthier choice easier for the people of India. There will be more these partnerships, evidence-based policies and innovation, entire population flourish. And WHO is happy to support in India in a way so that we can achieve digestive health for all. Thank you very much.
Thank you, sir. On this occasion, we would like to felicitate the individuals who have supported us in our initiatives in preventive hepatology and awareness of non-fatty liver disease. We request the dignitaries to kindly come forward for presenting the certificate of honor. We are glad to invite Shri L. Swasticharan, Additional DDG and Director EMR, for his exemplary contributions to integrating NAFLD in the National Program on Non-Communicable Diseases and its implementation nationwide. His strategic leadership, focus on prevention, and commitment to strengthening the healthcare systems have significantly improved liver health outcomes across India. His partnership in promoting comprehensive liver care is deeply appreciated. Now we would like to felicitate Ravin Singh Chauhan, Country Manager of Viatris, has made significant contributions to combating liver diseases in India, especially non-alcoholic fatty liver disease and hepatitis. He has played a vital role in offering free screenings as a part of the Viatris Lab's corporate social responsibility in collaboration with ILBS across the NCR region, which has resulted in more than 40,000 screenings that were conducted. Thank you, sir. Today, we are honored by the presence of our chief guest, Shri G. Kamlak Vardhan Rao, CEO, FSSAI, Government of India. He is an IS officer of 1990 batch from the Kerala cadre. He has earlier served as Director General Tourism and Chairman and Managing Director, ITDC, Ministry of Tourism, Government of India. He has served as the Principal Secretary, Public Works Department, as Principal Secretary, Finance and Expenditure, Government of Kerala. He has also served as Secretary of Kerala Tourism in 2014 and 2016 and Director Culture, Government of India. In a span of about 3 decades, Rao has served in diverse positions, including Chairman of Indian Tobacco Board, Joint Secretary, Industries, Government of Andhra Pradesh, Vice Chairman and Managing Director, Sports Authority of Andhra Pradesh. We request sir to kindly address the gathering on National Health Policy Directions for Digestive Health and Food Safety.
Thank you so much. Good morning to everybody. Greetings on World Digestive Health Day. Director and Chancellor of ILBS, Dr. Shivsharan Sarinji. Director General of Health Services, Dr. Sunita Sharmaji. WHO representative, Dr. Rodrigo. Good friend, Dr. B.B. Rivariji, Dr. M.K. Dagaji, doctors, students, ladies and gentlemen, I'm very honored to have been invited here as a guest of honor and share few of my thoughts on this auspicious occasion of World Digestive Health Day. Whenever I go, since my collector days, whenever I go to any doctors programs, any doctors fraternity, I always say that if God has given life, doctors give long life. So I have extraordinary respect for all the doctors, and we have seen human service that the doctors have contributed during the COVID-19 globally, particularly in our country. Well, in most of the places in the villages in India are in the Hindu tradition, in Indian culture. Whenever there is a wedding or whenever a baby is born, we say Shatamanam Bhavati Shatayu Purshashindriye Ayushvendriye Praditishti. That means you are supposed to be living for 100 years. Man is born or woman is born to live for 100 years, right? Maybe this will increase now. By the way, the doctors like Sarinji and others are contributing to the world scientific fraternity that we may live for more than 120 years or 130 years. In fact, I would quote Mahatma Gandhiji here that when the Cripps mission came here, then he told Mr. Cripps that, please go back here. We are not happy with the cabinet mission plan that you have submitted to us. And I'm sure that I'm going to live for 120 years and I will see India becoming independent. I'm quoting Mahatma Gandhi. Okay. In 1947 itself, if Gandhiji has mentioned that he wanted to live for 120 years, I'm sure these modern technologies advanced, we should be focusing on living for more than 150 years. I'm sure the days will come. So when when the God has given us this birth, and I feel very happy and feel very proud that I'm born in India. Whenever we visit countries and other places, particularly European countries, we feel the kind of food that they're eating and the kind of food available in this country, that India. So India is Kamadhenu, Kalpavriksha, Annapurna of rice bowl, wheat bowl, everything. Recently, Minister Shri Shivraj Chauhan Sahab has, during his press conference, he has meant that, we have produced, compared to last year, the growth of agriculture production amounting to 24 lakh crores. 3 to 3.5% is the growth of agriculture production here. 239 million tons of rice, 150 million tons of wheat, 232 million tons of milk, and oils, 40 million tons of oils. You can Google and see 40 million tons of oils, 27.5 million tons of pulses. So this is what India produces. And fruits and vegetables, 240 million tons of fruits and vegetables are produced in this country. We are accessible to beautiful variety of food, fruits, leafy vegetables, and whatnot. We are extremely fortunate for that. When we have this kind of Kamadhenu and Kalpavriksha in front of us, and what kind of food that we're eating, are we eating safe food or not? Are we eating nutritious food or not? That is what very, very important. As you have mentioned, so you have Panchabhutas, you have Panchendriyas, like I call Panchapandavas of human body, is the vital organs of the human body is brain, heart, liver, lungs, and kidneys. Anything happens to these 5 organs, you are dead. So are we taking care of these 5 organs or not? What kind of food which is getting into our body? The nutritional aspect, how we are focusing on that, how are the government policies coming to this? Right from the birth of child, in Anganwadis, we have more than 13.5 lakh Anganwadis in this country. So thanks to the Health Ministry, thanks to the guidance given by Honorable Prime Minister Narendra Modi ji, that Poshan Abhiyan is so popular that in the villages, all these babies are fed with the most nutritious food. The ICMR's guidelines, which last year it has come out, which mentions about what is cooked food, what is processed food, what is the one RDA, one recommended dietary allowance, how much it should be, and what is HFSS, high fat, salt, sugars foods. Everything is mentioned in ICMR guidelines, and these guidelines are popularly disseminated throughout the country to each and every nook of the corner. That is for the baby side, that how well we are taking care of. Recently, when World Liver Day, Honorable Naddaji, our health minister, has mentioned during the oath taking ceremony. I just want to read his statement here. The biggest issue is that knowingly or unknowingly, we do a lot of injustice to our bodies. We don't always know what is good or bad for us and often assume we are doing fine. That's why we decided to organize this health camp. That was during the health camp in Nirman Bhavan. At the very least, those responsible for public health should themselves be healthy. And again, his quote is mentioning what is encouraging is that many liver-related problems are reversible. If we adopt healthier lifestyles, these issues can be resolved. The liver can heal on its own. And what is important is to understand the condition and how to maintain it, even when it seems fine. Unquote. So how many people in the country, I was just talking to Dr. Sarin about, he was telling me that, whatever is being researched here, whatever is produced here, is not being disseminated throughout the country. So whatever is researched in this country, globally also. See, Food Safety Authority, I was mentioning to him, we have 280 scientists with us. I have 21 scientific panels, panel on pesticides, panel on milk and milk products, meat and milk products, on the pulses and cereals. So every time we try to learn from international scientific data on done by empirical research and all, and we try to adopt certain standards for the food. While adopting the standard, we see what is the nutritious food which is emerging. Last few years back, Honorable Prime Minister has released a standard set by FSSA on millets. You know very well, India is the largest millets producer in the world, 15.5 million tons we produce every year. So 13 millets, these standards which are produced, which was called as superfood. These millets were standards released by Honorable Prime Minister. And last year, when I went to Codex Alimentarius Commission, all of you know, Codex Alimentarius Commission is a representative of FAO and WHO. 112 countries participated in the 170 plus countries are the member countries there. On that day, 115 countries participated, and I made a presentation on the millet and the strength of our standards, and each and every country clapped and appreciated that what India is doing is great. It's only because of the leadership given by our Honorable Prime Minister, Narendra Modi ji, when he mentioned that we should let us celebrate millets as a millet year. United Nations declared it as a year of 2023 as a year of millet, and the entire country has it's like a festival. We celebrated G20 in every part of the country, where at the part of the G20, we included millets as a major component. And now millet, entire food industry is taking up the millets as the basic ingredient in there, whether it is biscuits or the noodles, in the noodles, and everywhere millets is coming up. Unfortunately, if you see the consumption pattern of millets, it's grown 14, as I mentioned, for 15.5 million tons is grown last year, but almost all 12% is grown goes into animal feed, 8% only goes into processed food, and the rest goes into alcoholic industry. So it is time that we try to educate people on the uses of millets, because it gives adequate nutrition. The one idea which you talk about. Then, when we realize that the micronutrients sufficiently are not getting into the human body, as mentioned by ICAR, we started doing fortification. Now, more than 3.5 lakh ration shops, fair price shops in the country, now only fortified rice is being served. It's fortified with iron, folic acid, and B12. Because the adequate micronutrients which should get into your body, it is not there. The protein, doctors have mentioned here, how much protein that should get into your body, that 1 gram for your weight, it was 70 kg, 70 grams, that we mentioned. So are we getting these proteins sufficiently? Everybody cannot eat meat, because Europeans eat a lot of meat. They get their calories. How much people eat? You can derive your calories only through carbohydrates or fats and proteins. 3,600 kilocalories is what an average American eats. UK 2,500 kilocalories, Saudi Arabia 3,300, and how much in Indian eat? Eats only 2,100 kilocalories. I told my scientists to give me one table of how much a North Indian eats and how much a South Indian eats. Morning breakfast, South Indian idli, dosa, little bit of paisam, and coconut chutney, and the fruit. So South Indian eats 1,895 kilocalories. So the North Indian eats little bit more, 1,900 kilocalories. Is it sufficient? And in this, how much protein is he's taking, how much fat he's taking? Whatever is available is not sufficient. That's why you have the nutraceutical industry has become so big, so huge in this country. Every day there's a new companies coming up to manufacture prebiotic, probiotic, whey proteins. So a lot of protein is coming from whey proteins. So in the process, what is happening is people are getting into processed foods. I'm not saying that you should not take whey proteins now. It is really good that lactose is good for human to your cells through the milk source. This is fine, but there is something called cooked food and processed food. People have to depend more on cooked food and less on processed food. Research is done on ultra processed foods. If it is 57% of the food in USA, it belongs to ultra processed food. So this has to be minimal. I'm not saying that ultra processed food is bad. The dependency on ultra processed food should be minimized. And government is taking every step. In the Honorable Prime Minister recently has mentioned that obesity and all 10% of reduction in the oils. When you talk about the liver, whatever oil which is going, we love oils, we love sugars, right? So 10% at least we have to do all pakodis and jalebis. Fries are so much, right? Europeans are eating with cheese and butter. They fill their liver with cheese and butters. We fill with our oils and so much of oils. Just now mentioned about oilseed production. We cannot survive that. Speaking about sugars, India last year we produced 394 lakh tons of sugar cane. So this much of sugar comes, and our culture is sugar. Our festivals are sugar. You pass 10th class, मिठाई खाओ. शादी हो रहा है, मिठाई खाओ. नेताजी जीत गया है, मिठाई खाओ. तो आपके मुंह में घी शक्कर is not a happy statement. So I think maybe you have to be really conscious about how much sugar that getting into your body, how much right from the childhood also, parents, it is ultimately the behavioral change which is important. Mothers also they add a lot of jaggery to the food which is given to the babies in the villages. They show Chandamama, they show somebody else and all, they fear them, and they do a lot of overfeeding to the child. That may not be advisable. So taking everything into cognizance, we FSSAI, we started a campaign. Women and Child Welfare Department also, they started a campaign. Director of Health Services, Minister, they have started campaigns on what is good to eat. Eat right campaign is what we have started, and what are the good things to be eaten. And Minister of Health, through their wing, trying to disseminate information about the balanced diet, which should go right from for the child, for the woman, for fishermen communities, for tribal populations in the villages, and self-help groups in the villages, for the farmers, for geriatric. Geriatric is very, very important. Who is telling them what to be eaten, what not to be eaten? So that also Minister of Health is concentrating on that. Again, our agenda of Fit India, Honorable Prime Minister keeps on mentioning about Fit India. Now, the dietary habits also have changed. People are talking about Mediterranean diet, European diet. Keto diet has come up. So keto diet, where you don't take your salary from grains at all. You take only from the fats. Okay, so butters, meat, chicken, and all. Somebody mentioned about organic food. Yes, there are two schemes of Government of India. One is from the Agriculture Ministry and the other is from the Commerce. Agriculture Ministry PGS, the Participatory Guarantee Scheme, where the villages, whatever is grown, that to get food into organic, that it has to, minimum soil has to be cultivated for 4 to 5 years. It takes from non-organic soil to get into organic soil, right? So that organic the villages, the community, all the farmers come together and decide that yes, these mandals, these districts, we have organic food cultivated. They certify with participatory guarantee scheme. There's a certification. If it is larger, for the larger industries, it goes for the exports and all. NPOP, National Program on Organic Production. That is from the Ministry of Commerce. Any NPOP is there, then you can be rest assured that this is organic. So because our dependence on pesticide, when you talk about organic, you have to talk about pesticides, raw material, raw food, which Dr. Sarin was mentioning. I was talking to the doctors. You talk raw food and raw carrot and all those are gone. When we were in the colleges, we used to take drinking water from the tap. Can I take the drinking water from the tap? Now it's not, it's not so healthy. So raw material also, a lot of raw vegetables, how advisable and all. If it is organic vegetables, yes, see. Otherwise, pesticides. So there is a problem of pesticides. Not every pesticide gets into your body and it is harmful to your human body. But certainly people are talking about why chilka nikal rahe hain, apple ka kya nikal rahe hain? Because we are not confident about the chilka, the pesticides which are there. But certainly apple, I've been eating, last 2 years I've been eating apples, and my HDL levels have gone up and LDL levels have come down. So this Eat Right Melas and other programs of the Ministry of Health and other women, it is like, all ministries come together and working towards the human health. And that, as you mentioned, is very, very important. And nowadays people are saying, they're not saying get well soon, they say gut well. So I think that is a thing which I would like to quit. And I'm thankful to Dr. Sarin for inviting me as the chief guest here. Wish you all the best. Thank you so much. Namaskar.
Thank you, sir. We are also proud to announce that since 2023, we have also introduced a millet-based menu in the food services in the hospital as well. And we have a special Dawat-e-Jigar menu, which includes all the millet-based dishes in it. And it is quite largely popular amongst our students and our staff as well. You can see the cards in the auditorium as well. Rishi Kashyap has said in Kashyap Samhita that Nacha ahar samam kinchit bhajyan upalabhyate shakyate api anna matrena narva kartum niramaya, which means no medicine is equivalent to food. It is possible to make a person disease-free with just proper diet. And indeed, with today's talk, definitely, food has a prime role in maintaining our health and curing the diseases as well. At the end, we are grateful to all our dignitaries today. Now, I will please request Dr. M.K. Daga, Vice Chancellor, ILBS, to present the words of thanks.
Thank you. It's my great honor, sir, that we have a very insightful and a thoughtful talk by Mr. Rao on food, and his insight, his knowledge, his sharing this wisdom here was of great help, I know. And I'm sure that he had, now at FSSI, will have high levels of food standard in this country. And be rest assured that what you eat is proper. Also, Dr. Sunita, my colleague from Lady Harding, it's meant that you came and spared your valuable time to address this gathering and this World Digestive Health Day. Thank you very much for gracing the occasion. Dr. Sitayo for also gracing the occasion on a short notice. Thank you very much and sharing your thoughts about what one needs to do. And as usual, Dr. Sarin gave us an overview of what we need to know, that what gut health and what you need to do as practicing physicians and all other members, that how do we keep ourselves healthy. Dr. Rivari for the introductory part. I would just like to say a word or so that I think 1908 or so, when the Russian scientist Ellen Metchenkov developed something called as Bulgarian bacillus, which was a lactobacillus fermented milk, Bulgarian diet, which was being served. Where he said, if you take that, you will auto-intoxicate your gut. And that's he's so right. When he won subsequently a Nobel Prize with Paul Ehrlich on immunity, who worked on macrophages and that thing.
So what we need to be careful is that what we eat is, of course, has to be healthy, but is a balanced diet. Thank you very much for being present here.
We request you all for a group photograph, sir. Group photograph.